Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and dress you, okay? I'm going to get the clothing tops and we'll get started, okay? I'm going to provide for privacy. On test day, you will remember for your equipment, you need to get 2 shirts because in one of your steps, you have to ask the client which shirt they would like to put on. I always want to give them that option, okay? All right. Now, for this skill, Ms. Smith, I want to make sure that I keep you covered up at all times. It's very important to remember the critical step for this is making sure you dress the correct arm, okay? So when you're undressing a client with a weak arm, you always want to undress the strong side first and then remove the weak side. In this case, her strong side is her left side. So we're going to remove the gown first from this side. All right, Ms. Smith, you'll raise up just a little bit for me. Okay, thank you. And we're going to just take this arm out. You want to keep your patient covered up at all times. We're going to slide that over. You want to just take this and slide this off. And you just relax this arm because this is her weak arm. Okay? I'm just going to move this gown out of your way. You always want to make sure when you're dealing with linen, you keep it away from your uniform. Always turn it inward. And you can lay that right there at the end of your bed while you're doing your other steps. Okay? Now, again, remember, in this skill, you want to ask the patient which shirt they would like to put on. Ms. Smith, which one would you like to wear today? This one? Okay, we'll put this one in your closet. Now you're going to go over to the other side because you want to make sure that you dress the weak side first, okay? So we're going to go over here. Her right arm is her weak arm. So what we're going to do is we're going to just expose this arm for a moment. Okay? Just do it just like that for me. You're going to go inside your shirt like this. It's just like you're holding hands, like you're going to shake their hand and you just slide it up their arm, okay? Now, in this skill, she's alert, so she can sit up for you. Ms. Smith, can you lean up a little bit for me? Thank you. I'm going to bring this around, okay? And you can relax. All right, now remember, her left arm is her strong arm, so she can assist you on this side here. And if you would, just put your arm in your shirt here. There you go. Again, you always want to make sure you keep your patient covered up so that they're not exposed while you're dressing them. Just raise up a little bit. I'm going to fix your collar. There you go. Now, when you're on test day, you can just button, if they have buttons, you can just do 1 or 2 buttons. You don't have to do all of them. But you want to make sure that they're nice and neat when you've completed the dressing process. Okay. We're going to come back over here. Just make sure she's okay. We're going to give her call bell. Now, in this skill, of course, she has a weak right arm, so I wouldn't give her that call signal in that arm, okay? Ms. Smith, here's your call signal. You just give us a call if you need us, okay? At this time, you'll be getting rid of your linen, okay? So we'll take this over to the dry linen barrel and dispose of it. Okay, we're going to place this gown in the dry linen for soiled linen placement. And then at this time, you would wash your hands. And the skill is now complete.